We move on to this now. Homeless people are at risk of being left behind in the COVID-19 vaccination drive if they do not have identity documents. Currently, South Africa's COVID-19 vaccination program requires that people enter an identity number when registering on Electronic Vaccination Data System. Now, let's discuss this. We joined via Zoom by U-Turn's Operations Director and Western Cape representative for the National Homeless Network, Jon Hopkins. Jon, thank you so much for your time and thank you so much for joining us this afternoon. Now, Jon, do you think the Department of Health has a clear plan to vaccinate homeless people?
So a week ago, I would have said, I don't think so. But actually, things have really turned around, certainly in the Western Cape in the last week. So thanks to the tireless work of Annika from the NGO More Than Peace and also a board member of the Hope Exchange, the MEC from the Ministry of Health in the Western Cape has visited people on the street and is trying to figure out how on earth do we get around this? Because some research that we've done across the city is that 70% of people currently living on the street do not have an identity document. Most of them have been lost or stolen at some point. And so this is putting a big barrier to accessing vaccinations. Yet on Friday at the Hope Exchange in the CBD, there's going to be a special on-site vaccination for anyone who is living on the street, and you don't need an identity document. Now, this is the first time that I know of across the country that this is actually happening. And what they're going to do instead of requiring an ID document, so if you've got your ID, great. If you know your number, wonderful. Otherwise, they'll use your name and your date of birth to identify your hospital record. And if you don't have a hospital record, they'll set you one up. And this will actually help people to get the vaccine. And it's being trialed. And there are other cities, Durban especially, is really looking at, can this work? And if this works well, then it can be rolled out across the rest of Cape Town and hopefully across the rest of the country for those particularly marginalised and underserved, usually, such as people experiencing homelessness.
Now, Jon, you work with homeless people across these two provinces that we've mentioned, and probably other provinces too. Talk to me about how have the homeless taken, to COVID-19? I mean, a lot of people, especially those that are living in rural areas that are far away from what's really happening in the center of the country, if I can call it that, don't really have access to information and enough information. Talk to me about just how people who are homeless, and we know the reasons, some of the reasons that they've left their homes is because they absolutely have nothing. How are they dealing with this?
Homelessness is a complex phenomenon. And the reasons for someone being homeless, for some people, it's family breakdown. Some it's loss of job. Some it's abuse at home. Some it's overcrowding. For some, it's addiction or mental ill health. And so a lot of people landing up on the streets, there's not a simple solution to that. For those who have been on the street, this whole time of COVID has been a particularly stressful, difficult time, especially those who have faced like the lockdowns. For example, lockdown number 1, I remember being out, I had a pass to be out and about during the lockdown. We were providing humanitarian services for people still on the street. People were shell-shocked. Their support network had disappeared overnight. And they had no idea what was happening, where they were going to get, who they're going to ask for food or for money. And so it was a big shock to the system. Interestingly, for people who've been on the street, for those on the street, social distancing has been quite easy. And so before the Delta variant hit us, actually the risk against COVID has been less. Those in shelters, indoors, lots of people there, that is a much higher risk. But for those on the street, information has been a problem. And I know the people that I've spoken with and my colleagues have spoken with have seen, whilst the majority of people would like to get a vaccine if they can, a number of people say, but tell me more. I'm hearing stories, I'm not sure. There is that vaccine hesitancy, and there is that need to actually educate and to inform people so they can make an informed choice about getting a vaccine.
Now, we know that there is clearly a lack of communication in terms of, vaccinating. We know that the one big message was that it is in your best interest, it is in the country's best interest. Talk to me about just, that from a hesitancy perspective. Are homeless people, very much keen to vaccinate because they understand what it means? Or is it a case of, this is another thing that government is telling me to do, and therefore I will do it? Or do you think that more still needs to be done in those different spaces?
More definitely still needs to be done. But it's about, where do we usually get our information from? We get our information, yes, from TV stations such as SABC, but we also get our news from our friends, from our family, from the internet. Now, those who are on the street don't have good access to the internet or to TV or other mechanisms for getting information, but they do hear a lot from friends. They hear a lot from people that are passing. They also see newspaper headlines, and so they get the headline. They might read a discarded paper, but there is a need to specifically work with people. So it's not out of fear. And a lot of people actually, though, are saying, no, I want to get the vaccine. But a number are saying, tell me more. They're not saying definitely not, but they're saying, tell me more so I can actually decide if this is the right thing for me, which is basically, it should be the same for all of us.
Jon, you've obviously explained that obviously a lot of the people that are living in the streets that are homeless don't have access to IDs. Some of them don't even, have ID numbers. How can then, can the Department of Home Affairs or government at large make sure that no one is left behind in this case? And can you perhaps just assure us, that no one has been turned away who has tried to vaccinate without a proper documentation?
Well, we will know that later this week if people are being turned away. For example, I know in Mitchell's Plain, the community health centre there are actually having a special day for vaccinating people living on the streets tomorrow. But they are requiring people to at least know their ID number. Now, there are a few people that have never had an ID. They may never have had a birth certificate or have never registered. The majority do. But do they actually know their ID number? And so it's going to be interesting to see if people are turned away. I really hope not. But actually, this trial on Friday that is actually using name and date of birth to look up a hospital number. And this is something that the Provincial Department of Health they're looking for a viable workaround that meets all the safety procedures, but also means that no one is turned away. And as I said, other cities in the country, other provinces are looking keenly at this pilot on Friday to see that, can this work? Does this work? What can we learn from it? So we can ensure that everyone in this country has access to a vaccine. Now, of course, it's not just the vaccine. We need IDs to register to vote. And there are local elections coming up at some point. So first prize would be mobile Department of Home Affairs coming along at different sites and providing replacement identification documents. That would be first prize. But let's not wait for different departments to come to the party and mean that people don't get the vaccine. So this workaround is a good one, but ultimately, just to be a South African and even access the 350 grant that Ramaphosa talked about a couple of weeks ago, you have no access with no ID. So ID documents, without an ID document, it means people are being shut out and left behind. So we need to find a way of providing easier access, and not just temporary IDs that last just a few months, but actually ones that full-term IDs, again, permanent IDs, would be really helpful. So that's a long-term solution that everyone in the sector is really looking for.
All right, Jon, thank you so much for your time this afternoon. Really do appreciate it. Jon Hopkins, and he's obviously from the U-Turns Operations Director and Western Cape representative for the National Homeless Network.